Everybody, welcome to Pick Dr. Osborne's Brain. We got a great live Q&A for you today. If you would like me to answer your nutritional questions, you can start typing those into the feed or into the chat box. And we'll do our best to get as many answered as we can. And if you're looking to support us, make sure you hit that like button below, and that if you're not already subscribed, hit that subscribe button. And don't forget about our site-wide sale this weekend for Halloween. The coupon code is, what is it, BOO13? BOO13 for 13% off. And that includes, the sale includes all supplement products, gluten, grain-free, as well as any lab testing that we perform. So whether if you're looking for micronutrient testing and you want to save some money, or food sensitivity testing or gluten sensitivity testing, you can just use coupon code BOO13 and save off of all of our products. So let's dive into your questions. Jessica says, what's the best way to take ultrabutyrate with or without food, with probiotic or without, with amino acids? No, so the best way to take it really is taking it with food. You don't have to take it with a probiotic per se, although it's good to chase your probiotic behind it. It's not necessary. Butyrate is for those of you who haven't watched the crash course on butyrate we did a couple weeks ago, butyrate is a postbiotic. So basically it's a byproduct of the bacteria in your gut. They take fiber and then they produce butyrate, and butyrate as a compound helps to manage the energy production of the cells in your colon. So, low levels of butyrate can potentiate a leakiness in your intestines. It can create dysfunction in your ability to regulate water balance. And so some people, they drink a lot of water, but they can't stay hydrated. Butyrate may be helpful with that. There's also research that shows that low levels of butyrate over time increase the risk of colon cancers and colon problems. So butyrate you can take with or without food. Best probably to take it with food. But as far as the timing of taking it with other nutritional supplements, there's really not anything that's contradicted that we know of. Now, if you're taking a medicine that says take it on an empty stomach, obviously follow your doctor's orders. Let's see here. Ruby says, I need to wipe out Candida. Do I take the Candida cleanse sup first to clear it out and then replenish the microbiome with probiotics, or are those taken together? So, I would suggest you take them together, but just don't take them at the exact same time. So your probiotic, if you're taking an antifungal supplement like Yeast Shield or caprylic acid, you would take that and then you would wait. You would either take your probiotic an hour or further than an hour before, that way it can get in, and then you would take the herbal, or you can take the probiotic an hour after. So an hour after or an hour before would be ideal for the probiotic. And then taking them together is important because we use 4 strategies when we're trying to balance out Candida. One is we flush the gut. We use vitamin C flush. If you're not familiar with that, we have some videos on that you can watch. So that would be day one. You set yourself up for success by flushing your bowel first, understanding that saturating your gut cells with vitamin C has antifungal properties, but you also, when you flush out your gut, you can flush out a lot of the problem on the first day. And so when you go to do the protocol, you're actually less susceptible to the detox responses that a lot of people suffer from, the die-off or the Herxheimer response. So the flush is step 1, then step 2, 3, and 4, all simultaneously done, is you want to create competition for yeast, and that's good probiotic. You also want to make it uncomfortable for them, so that would be things like Yeast Shield or caprylic acid. You also want to starve them out, so that would be following what's known as a low fermentation diet, where you're minimizing your carbohydrate intake because yeast thrive on carbohydrate foods. So if you eat a lot of carbohydrates, then it's a lot harder to get rid of them. And then number 4 is very simply put, you starve them. Okay, let's back up. You flush them out, you create competition for them, you starve them, and you poison them, right? So all 4 of those strategies, the last 3, the first is the flush, where you flush them out. The last three follow the flush. So hopefully that helps you understand that, how we do it a little bit more effectively. Is it a good idea to take the butyrate while fasting? You can. There's no harm in taking it while fasting. Some people just could get upset stomach if they take supplements on an empty stomach. So you just have to know, who you are and how your body reacts. So I would say if you're taking it on a fasted stomach and it bothers your stomach or you get upset, then obviously you would want to wait and take it with some food. But it's perfectly safe to take on an empty stomach, providing you tolerate it well. Debbie's asking, any grains that are acceptable to eat if gluten-free? No. Debbie, I would encourage you, and I'll put a link up for you, take our master class. It's free. You just have to register for it. It's free. It's on gluten. It's called Glutenology. And I'll put a link below for you, glutenology.net/registration. If you take the master class, I do a very deep dive on all the mistakes that people make when they're trying to embark on a gluten-free diet. And one of them is they try to include or continue to include corn, rice, oats, sorghum, millet, other forms of grain and pseudograins in their diet. And so most of these people, or many of them, and this is true in my experience clinically, but also true based on researchers and what they find. There's some studies that show that 92% of celiacs do not recover the intestinal damage on a traditional gluten-free diet. And so there's a lot of nuance to why that happens. Eating grains is one of those nuances, but there are other things as well. And this master class will do a deep dive into helping you understand that. And again, all you have to do is register. It's free for you to take. How does the microbiome and parasites affect the brain? Do parasites change how you think? What's the best way to train the brain and get stronger so that you won't get too tired, especially mentally? There's definitely evidence that shows that the microbiome influences thought and influences neurochemical production. You have a big nerve that goes from your gut to your brain called the vagus nerve. And 70% of the fibers are actually transmitted from the gut to the brain. The other 30% are from the gut or from the brain rather, to the gut. So the vast majority of the vagus nerve parasympathetic fibers are actually letting the gut talk to the brain. So what's in your gut can produce chemicals, neurochemicals that can activate this neurological pathway. And so we know, for example, that serotonin and dopamine, two very important neurotransmitters, most of them are produced by the microbiome, by the gut microbiome. And so yes, very much your microbiome can affect how you think. We don't have enough research or science that says, this species makes you think this way, or this kind of bacteria makes you think a certain way. This is all very new, this microbiome research. If you watched, my 2 episodes with Dr. Sabine Hazen, this is very new stuff, and it's very exciting stuff, but we haven't quite mapped it all out to understand the full implication of what certain species might cause. There are some studies that show that certain species can increase people's tendency toward depression, and that other species can create sugar cravings and other things like that. But again, it's very early in our full scope of understanding. I would say the best thing that you can do to train yourself to be stronger mentally from a microbiome perspective is don't take, and unless there's an absolute medical necessity to save your life, do not take antibiotics. Do not eat foods that contain chemicals that act as antibiotics. A number of our processed foods contain multitudes of different compounds, food preservatives, additives, and other chemicals, pesticides, that behave like antibiotics in our GI tract and can actually destroy, not destroy is maybe a strong word, but diminish the capacity of the diversity of our microbiomes. And so you want to understand that, because if you avoid those foods and you eat robust, real food, right? Expose yourself to nature, expose yourself to sunshine, expose yourself to clean, fresh air and water. Have good sleep practices, surround yourself by people you love and who love you back, right? So evaluate your relationships. A lot of people are in bad ones. These are all important to build your mental strength and capacity. It's not just one secret trick that you can do or one hack. It's, living a life that's congruent with your biology. And so starting from the fundamental premise of just eating real food and avoiding processed garbage and chemicals can take most people a very long way toward improving their health overall, including their mental strength and their energy. And if you're doing that already and you struggle, with mental fatigue and exhaustion, you probably should consider nutritional testing to evaluate whether or not you have deficiencies, because there are, iron deficiency, B vitamin, especially B12 and folate deficiencies can deplete, your mental clarity and your cognition. So these things can impact, your energy, your mental energy as well. So it's very common to see people, for example, with B12 deficiency have a lot of brain fog. So again, having that evaluated, if you're already doing the other things, might help you quite a bit as well. I had my pilonidal cyst drained Tuesday. Doctor didn't know any root cause. Are they related to the gut or maybe Candida? I don't want that coming back. I'm 2 months on no grain. Can I use castor oil or tea tree? You certainly can use castor oil and tea tree, although I would caution you how you apply it to the wound directly, to the surgical site directly. But pilonidal cyst, I have seen cases of those where in people that have had, because they have a really strong tendency to repeat. So if you've had them surgically removed, a lot of times they can come back. And I've seen several over people's sacrums in their spine and their low back where they kept coming back. And in those cases, when they went grain-free, we didn't see them come back afterwards. So that's not to say that there's any fantastic research that says directly that gluten and grains cause pilonidal cysts, but my clinical experience is I have seen repeat cases not repeat after changing diet. And so that being said, I could just share that information. Those are just case studies, if you will, but there's no great research linking directly pilonidal to gluten, and at least not to my knowledge. Maybe somebody's published something since I last checked, but as of today's knowledge base, no. High fibrinogen and D-dimer, does it mean heart issues? It means vascular issues, Peruse. So D-dimer is a protein in the blood. High levels of it can indicate something called microclotting, which is where your blood is clotting microscopically. Your blood viscosity is increasing and becoming more thick and clotting more aggressively. That can put pressure on your heart. Remember, your heart is a pump, and it has to be able effectively to pump the fluid through your body, although it's not just the heart that helps that happen. The charge of water in your blood also helps that happen. But the thicker your blood, the more coagulability that it has, the greater potential stress, and so it can definitely impact you. So clotting also has causes. So like D-dimer elevation is also indicative of potential vascular inflammation. So you'd want to kind of reverse engineer why that happens. And one of the things that we're seeing both in the literature, and I've seen a lot of this even in practice, is that people that have had the poke have elevations in D-dimer, and it's a very, very common thing where we'll see we see that their D-dimer is normal, and then they'll get a poke, and then D-dimer elevates, and so there's some implication that that's causing microclotting. Fibrinogen is very similar. It's a protein that is important in the clotting cascade, so elevations in fibrinogen can also indicate increased viscosity of blood and potential inflammation. So if you've got those two things, certainly it's worth working with your doctor to explore why they're elevated. It's not just the poke that can elevate them. There are a lot of different things that can do that, and you'd want to go through and explore the whys. Now, you can do certain supplements to help with blood viscosity just as a general support, but it's always more important to figure out why it happened, because the supplements are not necessarily going to resolve anything. But a lot of doctors right now are using proteolytic enzymes. My favorite formulation is something called Matrozyme, and you can check that out at Gluten-Free Society. The way you take that is you take 2 capsules 3 times a day on an empty stomach. It's the proteolytic enzymes. If you take them with food, they'll digest your food. If you take them on an empty stomach, they'll absorb into your bloodstream, and they'll have their effect in your bloodstream, which is what you would want with those markers being high. Beyond that, some people are also finding benefit with nattokinase, which is a product derived from soy. It's a powerful enzyme that helps thin the blood. But also there are many other nutrients, right? So omega-3 is very important for this, for blood viscosity. Selenium, vitamin E, very important for blood viscosity as well. So there's a lot of different things that you could use in order to support your blood flow. Let's see here. If I cut out all gluten and eat only organic fruits, vegetables, and meat, will this guarantee a healthy microbiome, or are there other factors to consider? There's always other factors to consider. I don't think there are any guarantees in life, Penny. I mean, you know, so when we embark upon a change, there are no guarantees that what the future holds. But you increase the odds of a healthier outcome or healthier expression. So eating real food, we know, for example, when we study the microbiomes of indigenous tribal people, the diversity of those individuals' microbiomes is vast. They have very rich diversity. We know that when we study the microbiomes, the diversity of the microbiomes of people living in the city eating processed foods, we know their diversity factors are far, far, far lower. We know that when people eat real food, diversity goes up. So there's a strong likelihood that it'll help increase your diversity, but there could be other things going on in your life or in your environment that might also be implicating problems in your microbiome. And so, you know, if you're still struggling, I would encourage you to consider that as also a potential possibility. Oh, let's see, Rosalind says, any suggestions on shedding, on poke shedding? I had bleeding in menopause from the poke shedding affecting my gut. I'm taking shelf-stable probiotics. Had baseline testing. Two things that they actually have been researched pretty well. One is N-acetylcysteine. And if you haven't watched my crash course on that, Rosalind, I encourage you to watch it. We can put a link up to it below. The other is sunshine. There's some interesting research on light actually being a very, very effective agent for the proteins that are being produced by mRNA. So, you know, I would just say the importance. I can never overemphasize the importance of sunshine, because most people, it's you know, a lot of people are willing to change their diet, but when it comes to exercise, sunshine, and other habits, those largely get, you know, shoved under the rug or dismissed as less important. But sunshine, in my opinion, is one of the most important things you can do on a daily basis. I actually have on my schedule every morning time to go out and sunbathe. And I say sunbathe, I mean is wear as little clothes as possible depending on where you're at, but getting regular direct sunshine on your skin every day without the use of sunscreen, to the toleration of your skin. So in other words, don't go out and roast yourself, but go out every day. There's so many benefits to the light. I mean, there's UV light that's very important for a number of functions. There's the red spectrum of light that you get from sunshine. There's vitamin D, there's melatonin, there's hormone regulation. There's so many benefits to light, and it's all free, right? A lot of people are buying all these expensive lights, you know, to put in their homes, which if you live in the north and you're less apt to get sun, or the weather is changed and you're less apt to get sun, then some of these light therapies are fantastic. But if you're like me and you live in the south, you need to take advantage of your geographic location and prioritize your time in the sun, especially if you want to help with any kind of shedding. Can't find a farmer that does not give their chickens and pigs some supplemental grain on a daily basis. Any suggestions? Yeah, you're not going to find, unless you know, the biggest suggestion is get your own chickens. You know, if you want chickens without that, you can feed, you know, there used to be some farmers that fed their chickens flax and then graze them, you know, so chickens can do really, really well outside on grass and bugs, if you've got enough room for them to roam. And then you can supplement them with worms. You can supplement them with, like, you can buy freeze-dried worms, or you can also buy organic flax meal as a good supplemental for chickens. But, you know, if you don't have the space to do your own chickens, you know, you have to do what you can. And in that regard, I would just talk to the farmers who do the least amount of supplementing, and make sure that if they are doing supplemental grain in a chicken, that it's organic. Because again, as a species, birds can eat seeds, and it's not going to impact them the way that it impacts humans. But their primary diet should not just be grain. It changes the fat of the animal. It changes the fat in the egg. You know, the omega concentration, you know, tends to favor a higher omega-6 profile, which is a more inflammatory type of fat if they're predominantly grain-fed. It's not that you would get gluten exposure, because it doesn't translate like that. Chickens eating grain doesn't translate into gluten in their flesh or their tissue, but it does translate into fatty acid changes in the meat that lead to less nourishment. Is it true that vitamin C reduces hyperthyroid activity? Well, vitamin C has a lot of immunoregulatory effects, but I don't think there's any really great compelling research in patients that have Graves' disease where vitamin C led to a resolution. But there is functionality for vitamin C. Vitamin C is very important in the production of thyroid hormone. There's an aspect inside your thyroid cells where vitamin C plays a role in that. So it certainly helps modulate production. But again, if you're talking about trying to like use it because you have Graves' disease and you're trying to normalize that, I don't think vitamin C by itself is going to do that for you. What do you recommend concerning testosterone for a 67-year-old man who has taken the hormone under physician's prescription since 2008? Work out. You got to work out, Pharaoh. If you're 67, you know, just depending on your physical acumen and shape, you know, you've got to start working out. And so you start at where you're at. You don't necessarily go and kill yourself trying to do more than you're capable of. Don't go be the weekend warrior. But you need to get physically active, because one of the best ways to improve testosterone is physical activity. You also need to make sure you're getting your vitamin D levels checked, because vitamin D deficiency can contribute to low testosterone. Zinc deficiency can contribute to low testosterone. Selenium deficiency, boron deficiency, magnesium deficiency, all these nutrients are very important in the bioproduction or the chemical production of your natural testosterone. So those things would all be things I would encourage you to look at, ask your doctor to measure, along with the exercise. The other is sunshine. As I just mentioned, one of the things that we know about sunshine, regular sunshine, actually in men and women, increases estrogen and testosterone. So those of you out there being pumped full of hormones, natural hormones or non-natural hormones, and you don't get regular sunshine, you know, you really want to consider sun as a potential agent for improving your hormone status. There's a lot of research that supports that. I've seen it clinically in a lot of folks' work. So dive into the sun. You know, there's so many flawed medical, there's so much flawed medical advice in the world if you look historically. And did we ever do a show on that? I thought we did a show once on all the bad advice that was ever given medically and nutritionally that went wrong, that was wrong, that we've come to find out that was wrong. Post that link. Those of you who haven't seen this show, I mean, I go back through the history of all the bad advice and all the wrong advice, and now the science shows how much all of it was wrong. And sunshine's one of them. I mean, you know, how many years have we been being told by dermatologists to avoid the sun, right? How nonsense is that when sun is critical and crucial to human health, and we're being told to cake up in a sunscreen that actually has agents in it that aren't good for your skin, and all for the sake of avoiding the natural sunshine. Now, you've got to be smart about it, you know, and if you're fair-skinned and you know, you don't go get on a boat or lay out on the beach for, you know, 4 hours, you'll roast your skin and get burns. But, you know, you've got to approach it from a smart way. The more sun you get, the more tolerable of sun you become. So start small, work your way up, but do it consistently daily without sunscreen. Anything higher than SPF 8 blocks vitamin D production because it inhibits the flow of light rays or light photon beams through into the skin. And that's what we want. We want that light coming in, because that's where a lot of physiological effect on our hormones occur. Let's see. Can dandruff be as a result of gluten? It can be. There are lots of things that can contribute to dandruff, but one of the reasons gluten can cause dandruff is that gluten can cause severe nutritional malabsorption in the intestines, leading to vitamin and mineral deficiencies. And many of these nutrients are important for the health of the skin. And so dandruff can be a byproduct of that when the health of the skin and the oils of the skin are not flowing properly. There's definitely a correlation between gluten-induced malnutrition and dandruff. I don't eat seaweed or much fish. Is it safe to take a couple drops a day of Lugol's to get my iodine? Yeah, I mean, you could, certainly. If you're worried about overdoing it, you can always get your iodine levels checked. If you're using any of our multivitamins, if you're using Ultra Nutrients, there's iodine in it, and it's it's not a mega dose, but it's a sustainable dose. So I hate seafood. That's just my own personal preference to not eat it, and I don't like seaweed either. One of the reasons why I formulated Ultra Nutrients with iodine in it, because I wanted to also take my own vitamin, right, one, and two, I wanted to make sure that I was getting something that I knew I wasn't going to be getting from my diet. So, but you could do it either way. Can we eat chickpeas, sprouts? I mean, you can. Chickpea sprouts, you're talking about the sprout that comes off of the bean itself. The sprouts are okay. Some people with gluten issues and extensive gut damage don't do well eating the chickpea, but the sprouts, the greens coming off the top, are generally pretty well tolerated. How long does it take to stabilize mast cells by using quercetin and NAC? There's not like a magic number, but generally speaking, quercetin and NAC are effective within 30 to 45 minutes. But it's not a matter of them stabilizing mast cells. It's a matter of them helping to regulate the membrane around mast cells. And so part of it depends on why you have a mast cell issue. Those things are used as symptomatic, like what we call green medicine. They're used symptomatically to engage with your mast cells to potentiate a reduction of release of histamine, therefore reducing the potential for allergy symptoms. But you really still want to figure out why your mast cells are overproducing. And because if you know the answer to that question, then you don't have to worry about using quercetin and NAC indefinitely. Now, if it's like a seasonal allergy thing, yeah, take quercetin and NAC. They work within 30, 45 minutes. And for some, it's just a dose response issue, depending on the dose that you're getting. But, a good dose for quercetin, a good higher dose of quercetin is anywhere between 1 and 4,000 milligrams a day. And NAC would be anywhere from 1,500 to 3,000 milligrams a day would be, doses that, you might find very supportive. Can you be specific with which rice is gluten-free and which isn't? Yeah, wild rice is gluten-free. All others are not. What's the reason for chronic hiatal hernia? Could it be from chronic stress? Could be. It could also be from malnutrition. We see a lot of times people that come to me have had like a prior diagnosis from their GI doc, and they've been told they have hiatal hernias. And then when we start working with them nutritionally and we start correcting things, and they have follow-up with their GI, a lot of times the hiatal hernia goes away. So it's my experience that a lot of times these chronic hiatal hernia issues are actual food-induced damage to the valve itself. And so when we fix that, the body can fix itself a lot of times. Now, that's not always the case, but that is a very common thing that I see. Let's see, Marcia says, I did a dumb thing. I ate at a Mediterranean restaurant that lists ingredients and thought it was safe. I ate grilled mixed vegetables. I don't tolerate aromatics, and there were onions, which I did not eat. So you picked them out, is what it sounds like. Do you think it's possible that the inflammation I felt in my chest was related to that? I mean, if you felt inflammation after the meal, it could have been a number of things. If it's a restaurant, cross-contamination is never off the table, especially, I don't know where you ate, but a lot of these Mediterranean places that I see are buffet style, and so there's always the potential for cross-contamination to occur. And then the second part of that question, can the gut and the heart become problematic together? Yes, absolutely they can. Is Himalayan salt a healthy option for cooking with? Yes, it's a great option. Do you think there's a correlation between celiac and MS? Absolutely. I mean, that's actually been pretty well studied. There's a lot of published scientific papers and case studies on patients with MS, multiple sclerosis also being celiac and vice versa. I've seen a number of cases of MS go completely into remission on gluten-free diets. And that's just my own clinical observations when we change people's diets. But there are a lot of potential triggers for MS. So, you know, gluten can be a very helpful ally as far as avoidance of gluten and grains, Teresa, but you also want to look at, I mean, two very common deficiencies that can really create problems for MS patients is vitamin D is one and vitamin B12 is another. Now there are others, but those two, you know, we generally tend to see very common. You need vitamin B12 to form myelin, and so because multiple sclerosis is an autoimmune destruction of the myelin sheath, you need more B12 to recover. So you should, you know, consider that and consider measuring that, asking your doctor to measure that, and don't have them measured in the serum, have them measured intracellularly. We've talked about that a number of times on the show, the difference between serum tests and cellular tests, light years apart, much more accurate to go intracellular. If your doctor won't do it, you can go to Gluten-Free Society and there's micronutrient testing, intracellular testing you can order there. And then vitamin D, and you can add, there is a blood test you can ask your doctor to run that insurance will cover. It's called 25-OHD. And if you have MS, you want that number to be between 70 and 100. I'm grain-free and the bottom of my right foot feels extremely bruised. What could be the cause? I mean, that's a really broad question, Lori. Did you injure it? Was there trauma? Or is it just a spontaneous bruise that you feel? Is it possible that your shoe that you bought doesn't fit right? Is it possible that you had something small in your shoe that was there, but so small you didn't notice it, but created a shift in your gait that led to kind of a bruising of the heel? I mean, there's just a lot of different issues there. It could be that your calves are very tight, and that when the calves are tight, the Achilles tendon that comes and attaches to your heel, to the bone heel, and it attaches to the fascia can actually create a pain and a bruise-like feeling in the foot itself. So depending on the location, there's just a lot. I would encourage you to visit probably one of the best types of doctors to visit in that case would be a good chiropractor. Podiatrists are good too, but a lot of times podiatrists just want to inject it with a steroid or they want to give a medicine to treat the pain, and they don't want to really examine why the pain is there. That's not always the case, but chiropractors usually have more of a kind of a root cause attitude when looking for why a problem exists in the musculoskeletal system. So as far as an exercise that you can do, stretch your calves. And there are a number of different calf stretches, but you know, one would be going down into a squat if you can and keep your heels flat on the floor. So when you go down into a squatting position, your heels should stay flat, so that as your legs come forward over the top of your heels, it's stretching the calf. You can also do toe touches, like bending forward to touch your toes, or even sitting on the floor and reaching forward to touch your toes. And in that position, if this is the leg and this is the foot and this is the leg here, when you're sitting and your legs are straight out in front of you, you would point your toes to your nose as you're reaching down to try to grab your ankles. And what that will do is that will isolate more specifically the calf muscles, which can, if tight, create heel pain and a bruised-like sensation. So those are just some things that you can do very simply. I read recently that most all common brands of salt, including Himalayan, contain dangerous levels of lead. I would have to see the research that makes that claim. There are a lot of people out there that talk a lot, Teresa, and you know, sometimes I would wish they didn't. But I would have to see, you know, what you're talking about. If somebody's actually taking different products and doing something called mass spec testing, which is very expensive to do. Mass spec testing, it stands for mass spectrometry, and it's a way to test for different types of contaminants and metals in food products or in supplement products. If you've got some evidence of research that's been done on certain particular products where they've done actual mass spec testing, then I would concede to say, yeah, that that's a concern. But without that kind of data, I just don't want to. I don't want to fall into the hype of the fear that a lot of people put out on the internet, because sometimes it's not necessary, and it deters people from doing something that could be a good thing for themselves. So I had a total thyroidectomy and radioactive iodine in January 2018. I have uterine fibroids, lots endometriosis, ovarian cyst, fibrocystic breast. Can I take Lugol's? Yeah, you can take Lugol's. There's no contraindication for any of that. Remember, iodine is an essential nutrient, and your body needs it. And if you've got fibroids and fibrocystic breast, one of the common deficiencies linked to those problems is iodine. So taking iodine would potentially be a pretty smart move. If you're worried about potential for side effects, just work with a good doctor or nutritional practitioner to help guide you through. But there shouldn't be any real major contraindication there. Is NAC recommended for someone with Hashimoto? I'm curious if it helps. I mean, why? You can take NAC if you have Hashimoto's. There's no contraindication there. NAC is not going to negatively impact Hashimoto's, but is it recommended if you have Hashimoto's to just take NAC just because? Not really. There's no great pertinent data that says taking NAC helps people with Hashimoto's. I mean, generally we use NAC as a mucolytic, so it helps to break up mucus. We can use NAC as an antioxidant, as it's a precursor to glutathione. We use NAC as a detox agent. It's got a lot of different kinds of purposes, but it's not necessarily going to resolve a person's Hashimoto's, but there's no harm in using it if you have Hashimoto's. Does magnesium citrate lower your iron levels or anything negative? No, I mean, the biggest problem with magnesium citrate at high enough doses is it'll cause diarrhea. It's an osmotic at high doses, so it can cause diarrhea. So if you're taking it and you start getting gurgling and have really loose bowel movements, you've taken too much. Let's see. Let's see. I think I answered that one. I'm low on vitamin D and need to supplement high doses, but I respond bad to it, heart palpitations, etc. How do I raise my D levels without cardiovascular issues? Yeah, get outside. And if the weather where you live is not helpful right now, consider a light box, and specifically a UV light box, one that actually releases UVB. And Sperti, S-P-E-R-T-I, is a good company for those. They make a good product that you can buy. I actually have one at home right now on my kitchen table, because when the winter starts to roll in, and I'll do UV light, 4 days a week, 3 to 4 minutes or so. Sometimes I'll do it even more frequently than that, depending on the weather, as a way to get vitamin D naturally. With less supplementation. But my experience too is that when people have low vitamin D and they respond poorly to supplementation, is that there's an underlying source of really strong inflammation. And so you might also start asking that question, if there's something else going on in your health that's driving your vitamin D down. The other thing you might consider is mushroom consumption. There's a natural food source for vitamin D. You also might consider liver as a source of vitamin D. And a lot of people tolerate that better than some of the supplemental forms. My friend contacted me earlier about mold in her apartment. It was on the walls, shoes, and most concerning, the mattress. Oh, how terrible. I don't think she should sleep on the bed. She needs to throw the bed away, throw the shoes away. She needs to move the hell out of there as soon as she possibly can. Get out. Mold is deadly. And if you've got it growing on your furnishings, you've got a hell of a problem. And it's no joke. It's really, honestly, in my experience, it's one of the few things that we see can threaten an individual's life very acutely for many reasons. But get out of there is the only advice I could give, and especially if there's a child there as well. Because children are much more susceptible. I can share my story. I was in mold. My wife and I both, and we were in mold for a number of years. Our health was slowly deteriorating, but really what gave us the clue and the insight was our dog died. Our dog was a little Yorkie, 9 pounds, and she developed, from the mold, she developed organ failure. And and she was affected. My other dog, who's a German Shepherd, was also affected, but made it out. He made it out alive, but it was affecting his health in a severe way. And he was 95 pounds, and he lost about 10 pounds body weight, before we got it all figured out and got the heck out. But if your friend's in that kind of mold, she needs to get out. Her life and her child's life is in danger. And she can have recourse with the apartment complex, because that's derelict on the part of maintenance. So she signed a lease with the apartment company, and they're not maintaining, the integrity of the complex. Then she does have legal recourse. And one of the problems with mold is it's expensive. When you got to throw your stuff away and move out, where do you go? How do you get out fast? There's just a lot of that. So she may also just consider looking for a good mold attorney that might be able to help her be compensated for the damage that was done as a result of the neglect of the person that owns the apartment building. Low total iron and low iron saturation. Does it require taking an iron supplement? Sometimes. I've seen cases where we put people on liver and, we can improve iron. I've seen cases where we had people that were avoiding meat for whatever various reasons, and adding meat back into the diet with its heme-based iron allowed them to make a recovery. And I've also seen cases where supplementation was necessary. So it really depends on the individual. It's not a one-size-fits-all, but it doesn't hurt to supplement with iron if you are low iron, low saturation. So it's not a bad idea, especially if you're a female and you're menstruating, because you're losing iron once a month on a scheduled basis, and that can exacerbate a pre-existing iron deficiency. Let's see here, Lala on TikTok. I haven't been able to use the bathroom, but I feel gas building up. Not sure what the question is, but if you're just struggling with gas and bloating, you can definitely consider diet change. Check out No Grain, No Pain. It's probably the quickest way to implement diet change that could be extremely helpful. Beyond that, if it's a major problem and you're having bouts of constipation where you're not going to the bathroom at all, that can be a medical emergency. There's the intestines can rotate around on top, and you can get a knot in your intestine, and that can cause a blockage, and that becomes an emergency. So if it's not something like that, don't necessarily worry about going to the ER, but if it's really, really bad, you might consider getting some imaging done with your doc. But as far as just generalized gas buildup and bloating, that's an intolerance. So you're eating foods that you're not capable of digesting very well. And so as they stay in your gut, the bacteria in your gut start trying to digest them for you. And a byproduct of that can be gases. And that can cause a lot of buildup and discomfort and IBS-like symptoms. And so you might also consider looking at the potential for food intolerances in what you're eating. But No Grain, No Pain is a great place to start, because a lot of the common food intolerances are eliminated with that diet. And so you might find some benefit just doing that. How are we doing technically?
Oh, good. We're good.
Okay.
This is from...
Okay. Let's see, can we go down? Okay, so Shirley says, curious, is it ever too late to expect a benefit going gluten-free? I have no known sensitivity to gluten, but do have RA and hypothyroid, have had multi-joints replaced and on methotrexate and Enbrel. Oh, I hate that you've had to have all that done, Shirley. I'm not sure I understand your question. It's never too late to improve. So don't ever be hopeless about the potential for improving. If you've had all that done and you've been on all those medications, see, this is the thing. I'm going to rant for a minute. So here's an example. Shirley is an example of a patient, and again, I'm going to speak from my own personal experience working in the VA hospital in rheumatology. So many patients are told, you better take Enbrel, you better take methotrexate, or your joints are going to be destroyed. And so the doctor uses this fear mentality, to basically, he or she uses fear to get compliance from a person, because the person's petrified that if they don't take the medicines, that their joints are somehow going to be destroyed. And in Shirley's case here, her joints were destroyed because she's had multiple joints replaced, even being on the medications. And this was my experience in the hospital system, is that so many people were told that, but their joints were destroyed anyway. It's just my opinion that those medicines do not stop joint destruction. Those medicines do not halt the progression of the illness. And those medications have a strong implication for causing other problems. So drugs like Enbrel, if you look at the black box warning on the drug, it causes cancer. That is one of the risks. It can cause lymphomas. If you look at the warning on methotrexate, that drug destroys the GI tract lining and inhibits folate. Folate is a very important B vitamin that's necessary for the regulation of your cartilage. And if you don't have enough folate, you cannot heal your cartilage. And RA is a disease of the destruction of the cartilage. Never made sense to me when I worked in the hospital system how they were ineffectively going about doing the work of treating patients when the outcomes were so abysmal. Now, all that being said, is it too late to receive some kind of a benefit even though you've been on those medicines and even though you've had joint replacement surgery? No. I've seen 90-plus-year-old people going gluten grain-free, having tremendous impact on their pain levels and on their quality of life. So don't ever think it's too late. All you can do is try, and it doesn't cost you anything to try, and it certainly could have a profound impact on your health. As a matter of fact, those of you maybe tuning in today, chime in with any of you who've had either like RA or autoimmune arthritis, different forms of autoimmune arthritis that have had benefit going on a gluten grain-free diet. Let Shirley know. Give her some positive hope walking away from the show today. Let's see here. Dana from Tucson. I'm on an anti-inflammatory diet for over 2 months, still dealing with tight fascia pain. Any suggestions? If you're on an anti-inflammatory diet for over 2 months, there's suggestions I could give you, but there's really more questions that I would want to have the answer to, which is, do you feel better on that anti-inflammatory diet, or do you feel no difference after 2 months? If you don't feel any better, then you're missing something. And so there could be a nuance in what, in what you're missing. You could be reacting to a food as part of your anti-inflammatory diet. You could have some deficiencies, certain nutrient deficiencies that are leading to, dysregulation in how your fascia is able to loosen up. You may need some physical therapy or some chiropractic work or some stripping. You might consider foam rolling the fascia to see if that gives you any relief as well. A lot of times when people have had major inflammatory problems, this is especially true in the muscles, in the fascia, in the tendons, in the ligaments, is those tissues, when they're chronically inflamed, will start to atrophy. And when they're atrophied, when you go anti-inflammatory, and there can be improvements in that anti-inflammatory, but the atrophy's still there, and you have to rehab that atrophy sometimes. And so if you're still having tight fascia, I would start probably with like foam rolling, or get a good trigger point gun. There's big massage guns with the big ball heads, and really get into that fascia and break it apart and do the best that you can to start releasing that fascia and see if that's helpful. And if that's not helpful, you really want to consider that you might be missing something. Do probiotic capsules work? I've heard some doctors now say they don't work because probiotics get destroyed in the stomach. They don't get to the colon lining. So, it depends on the probiotic and the brand. If you're using our probiotics, they're microencapsulated to get past the stomach on purpose, right? So we put a special coating around them so that they make it down into your lower intestines and colon. That being said, not all companies do that. It's expensive to do that. It's expensive to microencapsulate. And so, most companies actually don't do that. So some probiotics are worth it and some are not. Will NAC help a fractured ankle repair? If I were looking at trying to help with a fracture, like what kind of nutritional support, Mary, there are a couple of things that I would consider. We have something called a bone box. And I don't know if you're familiar. I put a link below, but it's a box with a couple of different supplements in it that it's designed to help support and enhance growth and repair of bone. So that would be one of the things I would consider doing. in that regard. The other would be, we also have a post-surgery protocol. And I know you have a fracture in it and you didn't go have surgery per se, but surgery is trauma, right? Surgery is scheduled trauma. A fracture is unscheduled trauma. And so you might also consider looking at our post-surgery protocol for nutrition support of healing. And we can also post a link to that for you as well. I love all these comments. So it was Shirley. Shirley, you were asking, is it ever too late to expect a benefit going gluten-free? And so you're not on Facebook, you're on YouTube, but there are a bunch of people posting on Facebook how they've improved. And I don't know if you are on Facebook, but if you are, you can go to Dr. Peter Osborne page and you can read some of that commentary. But thank you guys for posting that. That's always good to support each other. What's the difference between the Gluten-Free Society food sensitivity test and Cyrex test? Well, one, we test 222 things, so it's a lot more things that you're having tested. Two, we don't just look at IgG and IgA, which is what Cyrex looks at. They look at IgG and IgA. We look at IgG, IgA, IgM. We look at immune complex response. We look at T-cell response. So our testing is much more well-rounded in terms of looking at all the different potential ways the immune system can react to a food. So it's more comprehensive in that way. Is it true that Manuka honey is okay for a gut protocol? Yeah, Manuka honey is okay, although remember, you can overdo anything. And I think sometimes you say Manuka honey is okay. People are slathering Manuka honey all over everything they eat if they have a sweet tooth. Don't do that. But if you want to use some Manuka honey and you're following a GI or a gut protocol, it's perfectly fine. Manuka is a medicinal food, has actually got some antifungal, antibacterial, antiviral, antiparasitic properties. But, you know, again, I would just be cautious quantitatively about how much you consume. My son had RA, abdominal lymphedema. He went grain-free and lost 15 pounds of water weight. He was carrying in his legs. That's awesome, Lori. And his arthritis is so much less. He teaches guitar now. So he went from non-functional to functional just by changing his diet. Doris says, I'm 70 and joint aches have improved until I have a little pain in only one finger. I'm grain-free and eat no processed foods. Also, I eat organic as much as possible. Love it. TC says, Dr. Peter, a friend started to not feel good while out last week. Come to find out her blood pressure by the time the ambulance came was 220/160. She's a diabetic and does not want to take medicine. Eating habits are considerably poor. What are things we can do to help her? She's got to acknowledge the fact that she needs to completely change her diet and lifestyle. Diabetes is a disease of choice. And a lot of people get mad at me when I say that. It's not a disease of choice. I'm not talking about type 1 diabetes. That's an autoimmune disease. People don't pick that necessarily. But if you've got type 2 diabetes, you chose that lifestyle and your body adapted to that lifestyle. And so you've developed the consequences of that lifestyle. And so knowing that knowing and understanding truth is the first step to progress, right? You can't progress and improve unless you actually are telling yourself the truth and not telling yourself little lies. So if you don't want to be on medicine and you're diabetic, you first have to acknowledge the fact that your choices have led to your diagnosis, and then you have to reverse engineer which choices, right? And so for diabetics, you know, the culprit that most people hear about is sugar. Like, I'm eating too much sugar, drinking soda, eating processed foods, that kind of thing. That's all got to go. That's all out the window. None of that can be consumed anymore if you're diabetic and you're trying to control it without meds. Number two is grain. Grain is touted as this healthy, whole food for the vast majority of people, but grain is super, super disruptive to blood sugar regulation. And so this is one of the reasons why we see a lot of diabetics reverse diabetes going on a no grain, no pain diet. So she's got to be, I mean, I'd buy her a copy of No Grain, No Pain. And I'd say, get started, go to phase 2 of the diet and go. If she does that, the likelihood that she'll have and see improvements even in as little as a few weeks, I don't doubt at all. But you know, with blood pressure like that, where she's going to the hospital, she does need to be careful because, you know, you can pop an artery and now you got a stroke or a heart attack because you let it go too long. So medicine might be something that, you know, she wants to talk about with her doc, at least initially, while she's going through the diet and lifestyle changes, just to reverse, or not reverse, but to reduce the potential for a major life-threatening event. Because, you know, high blood pressure, when it gets up super high, it's no joke. You can die as a result of that pressure getting too high. And certainly you don't want to have her just, you know, change her diet without considering the risk and using the drug maybe even short-term potentially until she changes her diet. Lori says, is it true that eating a low-carb, grain-free diet can help type 1 diabetic reduce the need for the amount of insulin they take? Absolutely. I see this all the time. As a matter of fact, Mel, I think we have, his name is Michael. He's in our testimonial bank of videos. And anyway, he's a type 1 diabetic. And for a time, Michael was actually able to get off of insulin for a time with type 1 diabetes, which is unheard of. Now, I think eventually he had to get back on insulin, but his need for insulin was so much less than it was prior changing his diet. So we'll put that up in that story, and you can share that with your friend. But it's absolutely true that you can reduce the need for insulin when you control what you eat, and that is true also of a type 1 diabetic. I also catch a lot of flack from type 1 saying you can't do better, and I'm like, you're wrong. If you think you can't do better, then you can't do better. Your outcome is what you believe. But my experience with type 1 diabetics is they absolutely can reduce their insulin needs. I haven't yet met a case where they could permanently get off their insulin, but you can reduce it, and you want to reduce it. You don't want to be taking a ton of insulin if you can control a big chunk of it with your diet, because insulin, high levels of insulin over time have physiological effects that are not favorable, that contribute to weight gain and heart disease and increased risk for cancers and other things. So it's always better to control it the best you can with your diet and with exercise and lifestyle and behavioral habits. I have celiac. Is it possible to heal my microbiome completely, or do I always have more risk for gut problems? Leaky gut, diarrhea. I started keto 2022 and now 4 weeks on carnivore. So yes, it's possible to heal your microbiome in your gut. Your body heals. If you get a cut, it heals. It doesn't stay, you don't bleed to death when you get a cut. And your microbiome is skin, right? Your microbiome is bacteria and other life forms, but the intestine lining is skin. It's just skin folded inward into your body, right? And if it gets a cut, it heals, but it won't heal if you continue to do the things that caused the cut. So you got to reverse engineer what caused the cut. And if you're celiac, then gluten definitely was one of those things. There are other possibilities, though, as well. Somebody's asking about barley grass. I don't recommend it. If you a lot of these green drinks, a lot of that are being touted in on a lot of commercials and podcasts, you know, they got wheat and barley grass and other grasses in them. I do not recommend grass drinks. We have a product that is grass-free. It is a green drink, and it's called Ultra Food VF. And so if you want a barley and grass-free version, you can check out Ultra Food VF at Gluten-Free Society. We can put a link up to that below. But I do not recommend barley or wheatgrass or any of the other grass juices. Now, the biggest reason why is the tremendous risk for cross-contamination of gluten. And I've seen a number of cases where people were doing that, and that was one of the things holding them back from healing. Is it a good idea to take your activated charcoal supplements for detoxing after having a tooth filling replaced? Yeah, I mean, it's not a bad idea. Ideally with that is you take it as an agent to help reduce the risk, if you're having a mercury silver amalgam removed, to reduce the risk of that basically contaminating your body. So you're taking that binder to help kind of bind it if it does become a problem. But it's not a bad idea and it won't hurt you. Where people get into trouble with charcoal is if they take too strong of a dose, and not everyone, but sometimes people can get constipated when they take too high of a dose of charcoal. So just be on the lookout for that. Judy's asking, can you tell us what to take and why I'd have the flu? Well, a lot of people get the flu. There's nothing wrong with getting the flu. Everybody can get the flu. Anyone can get the flu. including myself, right? I get sick about every 7 years typically. Something will knock me out. You know, none of us are perfect, and we're all susceptible. And you know, there's right time, right place, right, to be sick. So while you got it, you probably had the perfect storm where your immune system was down, and so that launched and overtook your immune system. As far as what to take, I have a cold and flu protocol for nutrition support. Do we have a link to that, Mel?
Yes.
So we can put a link up for you, Judy. We'll put that in the chat feed, and you can check that out. I noticed some YouTube links in No Grain, No Pain are down. Will this ever be fixed? Yes. I think we're aware of some of those and working on getting those fixed. So but thank you for letting us know. A lot of chatter about avoiding almonds with skins now. I included almonds. Oxalates, question mark, other reasons to avoid almonds. The biggest reason to avoid them, in my experience anyway, is oxalate level, very high oxalate. If you have an oxalate issue. You know, almonds are high in oxalate. If you have an oxalate issue, it can contribute to joint pain. Oxalates are like little tiny crystals or glass shards that can float around and damage your tissue. So that's the biggest reason why you're seeing the chatter probably about almonds. You know, unless you're allergic to them, you can also be, you know, the person can also be allergic to almonds as well. But and sometimes too, depending on how the almonds are processed, they're processed with peanuts or they're processed with seed oils, like, so they're bathed in a like a cotton seed oil or another type of, you know, horrible seed oil that you don't want to eat. It could, you know, contribute to inflammation. So I don't recommend eating those kinds of almonds. But if you're shelling them yourself and eating them, you shouldn't have a problem with them unless you're either allergic to them directly or you have a problem with oxalates. If you want to learn more about oxalate, we have a whole crash course on oxalates, a YouTube video crash course on that topic. You should check that out. It includes food lists, what to eat, what's high, what's low. Yesterday you said that a TSH blood test can lead to a false positive for a thyroid problem. Yeah, so wasn't yesterday, but you may have watched a video of me yesterday. I didn't say that yesterday per se, but if you're taking iodine and you're getting ready to have your thyroid blood work done, you need to be off of your iodine, you know, a good solid week or so before you get your blood drawn, or you can get an artificially elevated TSH. So just be aware of that. Those of you who are out there that are, you know, that have a thyroid doctor, an endocrinologist that's wanting to do your blood work, if you're on higher doses of iodine, it can really mislead that doctor's analysis of your blood work. So, and you know, not all doctors, even though they should be, endocrinologists should be experts and should know that, but it's very rare, in my experience, that they warn their patients, you know, about supplementing with iodine before a blood test. But there's the two supplements you should never take before an iodine blood test. I'm sorry, before a thyroid blood test, are biotin, which is a B vitamin, and iodine. Those two can skew your results. And again, if your doctor's trying to navigate your medicine or figure out whether or not you need some support in some other way, it can really be misleading for him when he looks at it. Do we lose B vitamins by not eating wheat? No. There's plenty of foods with B vitamins. I would say wheat, you know, wheat not one of the best. I'm looking for more info on lowering TPO, thyroid peroxidase. Have you put out videos on this? I've got a really good, Karen, a crash course on the thyroid that you might check out. As a matter of fact, I think we just aired that a few days ago. If you haven't watched it, watch it. But the best way, in my experience, the best way to lower TPO is to make sure you get the right nutrients, because like selenium and inositol deficiencies can elevate TPO. And taking them, there's a lot of, I've seen this clinically, but I also see this all in the literature. is that those two supplements actually can reduce TPO. So those are things that if you're not doing now, you might consider getting them tested and talking with your doc about it. The other would be going grain-free. You know, I just had somebody a couple weeks ago, 1,000-point drop in TPO with diet change. That's it. We didn't do anything else. It was just in the limbo of waiting for a lab test to come back, but they changed their diet and 1,000-point drop. Amazing. You know, other food allergens and other food sensitivities can also elevate TPO. Mold can elevate TPO. So it just depends on what's causing yours to be high. What causes crackling sounds in the ears? You got to be more specific. Crackling sounds can mean a lot of things. There's tinnitus, and there are other types of sounds. You know, is it a neurological issue? Is it a is it a buildup of sebum in the ear that is creating kind of a sound as airflow goes across and hits the tympanic membrane? I mean, there's just a number of variable. Crackling, though, could be water behind the ear. You might have an ear infection, an asymptomatic ear infection. I mean, just a lot of different things. If you're real worried about it, get it checked out with your ear doc or your ENT. What about authentic Japanese matcha green tea? What about it? You got to ask me the question. You can't ask me, what about something? Because there's nothing wrong inherently with Japanese matcha green tea, but you know, there's a lot of nuance to that. You know, what specifically do you mean? Because it's high caffeine, and so you could be a person with gut problems, and high caffeine might not be a good idea for you right now. I mean, there's just a lot of nuance and variance to it. So maybe I frame your question a little bit more specifically, and I can be a little bit more specific in my answer. My wife was diagnosed with autoimmune. Is there any protocol you can recommend? She seems to get sick very often. Yeah, Alfred, no grain, no pain. Number one, start there. I wrote the book based on, at the time I wrote the book, it was based on about 18 years of clinical experience in seeing autoimmune diseases reverse. And so the protocol in the book, the diet in the book, is very, very effective for a lot of people. It's the quickest way to get started. And if you are following it already, and if she's following it already, and you're not seeing improvement, at that point, now it's time to test. You need to get with a good doctor who understands functional care, and you need to get the right testing done to understand there are 4 triggers categorically for autoimmune disease. 4. The first is food, the second is chemical exposure, the third is microbial imbalance, and the fourth is vitamin and mineral nutritional deficiencies. And if you understand those and you get the right testing done for those 4 triggers, you can customize or blueprint out someone's lifestyle and diet to accommodate their ability to heal. And this includes from autoimmune disease. Any suggestions on troubleshooting protocol for tinnitus? Can an MRI or CAT scan be helpful? I'd start with an MRI. CAT scans are awful radiative. MRI is not so much. An MRI might tell you whether or not there's lesions. But it's not going to tell you, if it does show you lesions, it's not going to show you or tell you why those lesions exist. But I mean, I've seen tinnitus be caused by parasites. I've seen it be caused by gluten. I've seen it be caused by B vitamin deficiency. So, you know, there's a lot of things that you should troubleshoot to try to discern or reverse engineer why it's happening. But I mean, tinnitus is just, it's ringing in the ears, right? It's an inflammation typically of the vestibulocochlear nerve, which is the cranial nerve that feeds the inner ear. And generally when there's inflammation, you know, you have to reverse engineer where that inflammation is coming from. What's a protocol for Crohn's disease? There's no one protocol. A lot of times, people like protocols, and I understand why. Protocols simplify the action steps that are necessary to take in order to try to help the body heal. The best protocol I could give you for any autoimmunity, whether it's Crohn's, celiac, arthritis, multiple sclerosis, it doesn't matter, is follow no grain, no pain first. Like, that diet is based on years of research and years of clinical practice. Beyond that, there's no one size fits all. Everybody's unique and different. And so fundamentally, the best protocol for Crohn's is work with your doctor to get tested for the triggers: food, chemicals, microbial imbalances, nutritional deficiencies. If you're doing that, you customize your protocol to match your own unique need. because there are some people with Crohn's that are reacting to dairy. There are some people with Crohn's that are reacting to broccoli. There are some people with Crohn's that are reacting to onion. It's very unique for the person. And so although protocols can be a helpful starting point without any testing, you get to the protocol and get beyond the protocol, you get to unique, customized guidance. Best way to absorb inositol, empty stomach or food. Either way, there's not an enhancement or a preference, whether you take it on an empty stomach or with food. Does quercetin still help if you don't take it with zinc? Yes. Quercetin works independent of zinc. How to increase microbiome diversity? I've answered that question already. Casey, let's see. Any supplement for dandruff issues? Depends on what's causing the dandruff issues, but kind of low-hanging fruit. Make sure you're getting adequate omega-3 fatty acid in your diet. Make sure you're getting adequate vitamin C in your diet. Are there any risks involved with getting a tube grommet inserted into my ear for eustachian tube dysfunction? Yeah, you're inserting a foreign object into your body, and there's always the potential for an immune response with a foreign object. That's the risk. You might consider having your ears adjusted if you're getting something inserted like that for a eustachian tube. Sometimes you can get your ears adjusted and it opens up the eustachian tubes and helps them drain better. And I've seen cases where people were able to not get those inserted as a result of a physical opening. You might also consider, if that's happening and the eustachian tube's not working, why? I mean, are you allergic to something? Is that creating a lot of fluid? Do you have an infection? There's a bunch of potential issues or things that could also be going on. It's creating the need. And so using a surgery to correct a dysfunction, although it may be helpful, may be useful, it's certainly not going to resolve or solve why the problem is happening in the first place. Thoughts on endocrine disruptors, plastic containers for bottled water. Don't recommend drinking out of plastic. I've got a lot of thoughts on endocrine disruptors. We've done some shows on that, on chemicals, that you can go check out as well. What's your protocol for MG? Define MG. MG could be myasthenia gravis. MG is also an abbreviation for magnesium. What are you referring to, Marcia? If it's myasthenia gravis, again, I'll repeat what I said earlier when somebody asked me the question about what is a protocol. My protocol for anybody that has any type of autoimmune diagnosis in terms of their diet and lifestyle and nutritional support is to follow no grain, no pain. It's always the first place to start because it's not going to interfere with any medicines you're on. It's not going to interfere with any medical care that you're receiving, but it has the potential to dramatically change your life and the potential to save your life depending on your disease. Is there an update on No Grain, No Pain, or is the content still up to date? It's very, very much up to date. I could go in and I could probably do an update and add 200 or 300 pages, but it's not necessary. Most of that would just be from the confirmation of a lot of what I was saying years ago, confirmation of that with more research that has been done to confirm what I've been saying all along. But there's no need to update it at this point. I probably will at some point, but you follow it, that you're not going to miss anything critical. Would it help my autoimmune condition to get saline implants removed? Very possibly so. There are people that suffer with autoimmunity as a result of surgical implants. It's called ASIA, autoimmune syndrome induced by adjuvants, and in this case, the adjuvant being the implant. So, very, very much could be a possibility, but before you surgery is that's a big thing to commit to. Before you just jump into it, you'd probably want to work with someone to help you understand more effectively whether or not that's a possibility. And if you haven't already changed your diet and lifestyle, I don't recommend surgery as a first option. Generally, I always recommend people do the low-hanging fruit first. Change your diet and lifestyle first, because if your symptoms resolve and you get better, then, problem solved. If they don't, now you can think more about whether or not you have an implant-related illness. and you can get confirmation or do some testing to confirm a greater potential for that. Would I start a petition to get the FDA to reevaluate corn as being truly gluten-free? I would, but I don't think it'd do any good. The FDA doesn't care. That's my opinion about the FDA. The FDA is just my opinion. Take it for what you will. The FDA is captured by the industry, right? The FDA is supposed to be our watchdog, and in reality, the FDA is a revolving door between pharmaceutical industry and the FDA, and so you saw all that play out in the last several years, with the guidance and the advice that was coming through. God forbid anyone take vitamin D. If you guys remember, I was censored for 3 years because of talking about vitamin D for COVID, and then we had hit pieces that were written about me in the New York Post and Business Insider. The title of the article was "Doctor Recommends Lethal Doses," and it was about vitamin D. So, I mean, that's the FDA. That's what you get. So to petition them, in my opinion, I like to do things that are fruitful with my time, like being here with you guys today and actually giving you tips and advice that you can hit the ground with running that possibly could change your life. But reforming the FDA, in my opinion, is not a possibility. It's too far gone. That's just my opinion. Take it for what you will. Let's see here. What's my take on nutritional yeast? Not a fan. We have an article on nutritional yeast, and you can go check that out on Gluten-Free Society, Andre, if you want to read a little bit more in depth about my opinion on it. I want to be able to digest coconut flour. How can I help myself do that without bloating? You might try a digestive enzyme. If they don't work, then you might just consider that coconut's not the best food for you, and your body's talking to you. Remember, there's 3 rules about eating that you should always consider. The first rule is you can't get healthy eating food that's not. The second rule is listen to your body. If your body sends you symptoms, when you eat something consistently, then your body's right. Listen to it. And then the third rule is, if you're not sure, get tested. Test for food sensitivities, and then avoid what you're reacting to based on your chemistry. What vitamin supplements should we take for grain-free diets? You could start with our starter kit. We have a gluten-free kind of starter kit that contains multivitamin, omega, probiotic, and digestive enzymes. So those would be the 4 kind of gold standard starting places for supplementation to support you. Lost 15 pounds in 2 months on no grain, no pain. Inflammation significantly decreased. I'm surprised my psoriasis hasn't improved. Ideas to bring it home. You may have other triggers. Grain is a trigger, or can be, but it's not always the only one. So ideas to bring it home: get nutrition tested, get food sensitivity tested as starting points. You also might consider, checking for yeast. Yeast oftentimes is present in cases of psoriasis, and so that in psoriatic arthritis, so getting that tested to see whether or not you have a yeast induction of the autoimmune process in the skin. That's where I would start. So that's why, let's see here. Sun is difficult to get in the UK at this time of the year, even though I play tennis. Too cold to strip off. Agreed, Ruth. Get you a sun lamp. It's a simple solution. They're not super expensive, but when you live in that area of the world, the benefits, in my opinion, the dividend will pay out over time of having something like that where you're not capable of doing it on a regular basis because of the geographic location. Do you do phone consults? Washington State here. Yeah, Vicki, you can reach out to us. We can put up contact information for Vicki. What causes cysts on the pancreas? Lots of things. There's not a definitive. I don't think anybody knows for certain. I have theories or thoughts about it. I've seen gluten I've seen cysts shrink when people go gluten-free. I've seen cysts shrink when people deal with yeast issues. But, again, it's hard to know that those are the causal or associative. It's hard to say. And to my knowledge, nobody really truly knows. It just hasn't been studied well enough. Recent TSH showed false positive on low iron. Recent TSH test showed false, that doesn't make sense, showed false positive on low iron. It doesn't make sense what's your question. You have to rephrase it because I don't know how to answer it because it doesn't make sense. Can you recommend an affordable sun lamp? Sperti, S-P-E-R-T-I. They sell them on it. I know Amazon carries them, and they're a few $100s. But when you buy them, they last. They're going to last you forever. So I mean, think of it as an investment. If you're trying to budget and you're trying to justify the expense, if you live in an area where sunshine is really hard to come by, there's just no way I would scrimp and save. I'd work a second job, if that were the case in order to maintain my health. What's the old saying? Well, it's kind of like that, but nothing tastes so good as it feels to be healthy. Once you know what it's like to feel healthy, you don't ever want to go back. And I would imagine many of you watching this show are either experiencing poor health or have experienced poor health. And so those of you that have overcome, I think you probably would resonate with that statement very well. Because health is the only thing that matters. If you don't have your health, then you don't have the ability to interact with those you love. You don't have the ability to shine your light to the rest of the world. I mean, how can we shine our light, our gifts, our talents, and make the world a better place if we're struggling, right? If we're struggling every day just to keep our head above the water, right? So when it comes to your health, most people will invest $1,000 in a cell phone, but won't invest a few $100s in a light. In a light box. And to me, that's an issue about priorities. We all have the priorities we all have, right? And not me judging any of you that have a different priority than I do. That's your business. But if your business is trying to be healthy, you have to prioritize health. And then we don't live in a world where that's a natural fit. Like, it's not natural for society. If you follow along with the rest of the world, if you follow along with the rest of the industrialized world and society, that is not healthy. There's a lot of mindsets that are unhealthy. Narcissism, through social media has become rampant. You have spiritual problems in the world. You have people that believe that Taco Bell is okay every day. You have people that believe that school lunches for their kids, where the only vegetable they're getting is ketchup, and that ketchup could even be classified as a vegetable, is okay. I mean, you have so much going on in the world that is normalized that creates illness and creates disease. And if you don't break away from that, that requires courage, and it requires a kind of a recalibration of what you do truly prioritize. If you prioritize fitting in socially, then you're not going to be healthy. That's been my observation over several decades of practice and life in general. And so you have to stand above the crowd, and you have to separate yourself away from a lot of the societal norms if you're on a journey to restore your health. Because if you justify, hanging out with societal norms, you're going to justify your illness for the rest of your life, and your quality of life is going to be diminished. And when your quality of life is diminished, your quality of relationships are diminished, the quality of everything is diminished. I was recently diagnosed with EE, eosinophilic esophagus or esophagitis, after a scope. The procedure flared my oral lichen planus up bad. I don't know that it flared your oral lichen planus, is that the two are probably the same origin. Oral lichen planus can be fungal in nature or yeast in nature, Candida, as can EE. It's very common for EE to have a fungal origin. Steroids will reduce the inflammation, but it will not solve or resolve the issue. So you might look at, aside from diet change, which never a bad idea to be gluten-free, grain-free, but doing an investigation as to whether or not yeast is playing a role in this. I've seen that a number of cases, Teresa. And yes, if you reach out, we do telephone nutrition, telephone consults. Can tooth infection cause heart inflammation? Yes, the bacteria that can manifest under the teeth, those bacteria can translocate through the bloodstream to the heart, creating heart inflammation. So absolutely. Best way to get our metabolism in check for weight loss? Boy, that's a big question, Connie. Simple answer is eat less than you need, and you need a deficit of 3,500 calories a day, or a week rather, to lose 1 pound a week, which is a consistently safe way to lose weight. But so that can be done through either food restriction or exercise. It should be done using both. A little bit of food restriction, a little bit of exercise, get your metabolism going. Go outside, get sunshine. A lot of people, again, benefits of sunshine are the freest and the most unparalleled benefits in the world in terms of so many aspects of good health. And it's such an over-ignored component, and it's so free. Like, it's, you know, if I could say, you could only pick one medicine in the world that you could do, and say, go outside, spend a few hours a day outside. White rice is gluten-free. Didn't you say rice isn't gluten-free? Yeah, rice is not gluten-free. It has a white rice, black rice, brown rice has a type of gluten called orzonin, and it's considered gluten-free by the governmental powers that create the food labeling laws. But orzonin is not gluten. Orzonin is a type of gluten, so rice technically is not gluten-free, and many people react to rice who are gluten sensitive. And so the only kind of rice that is technically gluten-free is wild rice, because it's not a grain. So hopefully that gives you clarity. We also have some classes on rice and some really comprehensive videos on rice. Okay, I think, how much, we've gone over quite a bit, haven't we? Yeah. Yeah, usually my stomach starts growling during the show, and I know it's time. So, hey, if I didn't get to your question, come back next week. We're here every Thursday at 12:30 to take on your toughest nutrition questions. And also make sure you, if you haven't, hit that subscribe button. Hey, and if this show is valuable, do me a favor. How do you support us? Well, you can share the show. Share it with somebody who you love, who you know needs this information to improve their own health. That would be the easiest way to support us. Subscribe and come back and watch. The other way, you go to glutenfreesociety.org and make sure that you sign up for our newsletter there. That's how you avoid censorship, is if we can communicate to you through email, then we can bypass any kind of censorship that happens as it happens. And 3, if you're in for products and you're looking to get lab testing, if you're not sure about food allergies, if you're not sure about gluten, if you're not sure about nutritional supplements or which ones to take or what nutrient deficiencies you have, use our services at glutenfreesociety.org. Your sponsorship through using our products is what makes this show possible. You know, this show is not free. I have 11 staff members, and a lot goes on behind the scene that you don't see every day to put this information out for you. This is not a plea for me, for you to say, come and spend all your money with me. But if you want to support the show, we greatly appreciate that support, because it's that makes it possible. So those of you who already are supporting us, greatly appreciate you. Those of you who aren't, consider it. And either way, come back next week if you want to learn more, because that's what it's about. We're trying to save 100 million lives, and you can hashtag save 100 million lives as well. That's also helpful when you're sharing these videos. So again, thanks for joining. We'll be back Tuesday for another show, another crash course, and Thursday for Q&A. Have a great weekend. We'll see you next week.